Welcome to this bite-sized presentation regarding bariatric weight loss surgery assessment. Your initial clinic appointment will be when you're seen and assessed by the bariatric consultant surgeon. This will be a face-to-face appointment in the hospital where you will be assessed and considered for surgery. Surgical types will be explained and information will be provided. If the surgeon feels you are an appropriate candidate for surgery, they will invite you to have bloods taken prior to leaving the hospital, and you will be invited back to see the bariatric team members of the multidisciplinary team on a different day. The appointment for the multidisciplinary assessment will last a number of hours and in some cases most of the day. If the surgeon does not feel you're appropriate for surgery, they will inform you of the reason why and refer you back to your GP or on to another hospital if required. Assessment clinic. You will need to attend a multidisciplinary clinic where you are seen and assessed throughout the day by various members of the team, including the dietetic team, the anaesthetist, the clinical nurse specialists. Some of you may be required to see the psychologist during the appointments or somebody like the endocrinologist who deals with diabetes and thyroid issues. In some circumstances, all the team members might not be available on that day, and you may be required to attend a catch-up on another day. You will have had your bloods taken at your initial clinic appointment, and we may provide you with the results on this day, and you'll be advised by the dietitians, for example, if your vitamin D levels are low and you need to commence vitamin D tablets. The clinical nurse specialist will carry out an ECG, which is a reading of your heart. We ask you to wear loose clothing, so we'll be able to access your knees, and we will ask you to remove your tops. Ladies, you may keep your bras on. You will also be asked to complete a breath test looking at carbon monoxide levels. If this is detected, then you will be required to stop smoking or vaping prior to surgery. This will be repeated prior to being offered surgery and again on the day of surgery. Following the clinic, there is a multidisciplinary team meeting to establish whether the individual disciplines feel you are appropriate for surgery. It may be that we're happy for you to have surgery with our team with no additional investigations, and we will add you to the waiting list. It may be that we feel you are appropriate for surgery, but you may need further investigations such as sleep studies. You may need to see another team such as the endocrinologist, the haematologist. You might need some investigations such as an endoscopy. It could be that you're having tests carried out in your local hospitals, and we might need those results before we can proceed. It may be we decide that you are not appropriate for surgery at all, and we will refer you back to your GP, or we're not appropriate at our hospital and we will refer you to another hospital such as University College Hospital in London. So what can you do following this session? Stop smoking, e-cigarettes or vaping if you currently do so. Continue with your weight loss. Increase your activities as you are able. We appreciate not everybody is very mobile. Think about any questions you might have for the team on the assessment days and what type of surgery you are considering. Continue with any counselling or support you may be receiving. Thank you for watching this video. We hope you have found it useful.